The cornea is pre-marked at 0 and 180, and with the Mendes corneal ring, we have marked 15 degree for the toric IOL insertion. It's a 2.2 millimeter incision, which is given either on the steep axis or temporal 180 according to the pre-calculation. Have used blur hex dye to stain the anterior capsule under air, and 2 side paracentences are being done here. Make sure that we have used a good viscoelastic. You can use a chondroitin sulfate to keep the anterior capsule flat, because there is a little intumescent look to this lens, and after the initial nick, it's going pretty well. It's a central curvilinear rhexis. Size is 5 millimeter to cover the anterior edge of the IOL, because this is a toric IOL, has to go properly in the back. At every point in time, the capsule has to be absolutely flat with a shearing force. Make sure that it meets the edge from the outside side. So there the rhexis is beautifully completed. Hydrodissection, inject saline under the capsule. Make sure that your nucleus is rotating well. So because the central look is a hard cataract, I'll be making a groove and trenching in the center so that I get a good hold for further chopping. So I'm making a central trench here, and after my initial attempt to chop, I see that the pupil drops down, constricts. So I'm using an intracameral adrenaline and some viscoelastic, and it gives me a decent sized pupil here. So we begin with our chopping, and as you can see, it's a pretty leathery cataract, but we've got a good first cut and chop here. In these kind of leathery cataract, it's very important to get a good hold of the nucleus with your phaco. So make sure that you're using the right amount of energy in a combination of phacoemulsification and torsional. So complete cracks right down to the center. Keep holding well, keep chopping through and through. Bring the segment onto the iris plane, get the chopper edge to the center, and emulsify. You can stop and use viscoelastic in between to protect your endothelium. That's almost the last piece, and that's the last plate now. Make sure that you keep your posterior capsule well protected, because we need the IOL to be in the bag and align it properly. So the bag integrity is very important. After the nucleus, it's cortical aspiration. We are using a bimanual cannula here to aspirate the cortical matter. Once your bag is clear, inject the toric IOL in the bag. We are injecting the toric intraocular lens through a 2.2 millimeter incision here. Center it well inside the bag, and normally I keep the toric axis say 5 degrees short of the actual alignment, because by the time we aspirate the visco and seal the wound, it then perfectly matches onto the corneal alignment. So visco aspirated, lens centered, axis aligned, wounds are hydrated. And to know more about the intraocular surgeries and cataract surgeries, you can log on to our website eyecaregurgaon.com. Thank you.